Hello everyone and welcome to another high yield USMLE question. This is going to be 59th question in the medicalized question bank. This is a genetics question. So we have a 38-year-old female presented to the office because of flank pain for the past 1 month. So it looks like something renal going on. The patient thought it would go away on its own, but it did not. The patient also complains of headache, especially when waking up in the morning, and occasional vomiting. Remember, this is high yield part of this question to know. Whenever they give you in a board question that headache worsens when waking up in the morning, they're telling you that there's something intracranial mass is going on. Something is increasing the intracranial pressure. And occasional vomiting. And vomiting is also something intracranial going on. Intracranial mass is there. And so the patient has no significant prior medical or surgical history. Vitally, the patient is stable. Examination did not show anything significant. Urinalysis showed hematuria, 2+ protein. So now that is going to tell us there's something renal definitely going on. CT scan now shows a renal mass. So that's renal cell carcinoma. So the hematuria, the flank pain was because of the RCC. CT scan shows cerebellar mass. So that's the headache on waking up part is going to be explained by the cerebellar mass. So which the following clinical finding is also associated with this patient's condition. So remember, the key points here are headache on waking up, which is explained by cerebellar mass. The vomiting is also explained by the cerebellar mass. The hematuria, flank pain is explained by renal mass, renal cell carcinoma. Now, this is VHL. So VHL is going to be a cancer syndrome. VHL has 3, which is von Hippel-Lindau disease. 3 letters. Chromosome 3 is the abnormality, and we have 3 tumors commonly. They can give you pheochromocytoma, which is episodic headache, hypertension. So they can definitely give you that. And because of the sympathetic overdrive, because pheochromocytoma is a medullary tumor of the adrenal glands. And so in the medulla, from the medulla, you release a ton of catecholamines, epinephrine, norepinephrine, that can cause episodic hypertension and headache. And so that's pheochromocytoma. Now, another is the hemangioblastoma, and it can occur in 2 locations classically. It's going to be cerebellum and also the retina. So the retina can get hemangioblastoma, the cerebellum can get the hemangioblastoma. So, and then the third thing is the renal cell carcinoma. So these are the 3 things. So 3 tumors, 3 chromosome 3, and 3 letters. And remember, pancreatic cysts, they can also give. So the answer here is now would be C, right? So A is the wrong answer, which is bitemporal hemianopsia. It's going to be seen in, for example, tumors of the pituitary glands. So they can give you craniopharyngioma. They can give you, for example, prolactinoma for bitemporal hemianopsia. And then elevated JVP with crackles or lung auscultation is going to be heart failure, which is not going to be seen with VHL. Spider angiomas on the skin are going to be seen on CLD due to hyperestrenism. Remember, they can give you a lot of hyperestrenism features in CLD, and they can ask you, okay, so we have spider angioma, what else has the same mechanism? And then they will give you a bunch of options, for example, which are also due to hyperestrenism. For example, spider angiomas, pulmonary erythema is because of hyperestrenism, testicular atrophy, gynecomastia. So these are all hyperestrenism feature. The answer here is going to be C. That's going to be pheochromocytoma, and these are the 3 tumors that I already talked about. So remember, VHL, high yield. They can ask you this in genetics, and any board exam, any step 1, 2, 3, they can ask this, and also on comp exams. So genetics question, if anyone requires tutoring, they can email me at medicalized@gmail.com. I offer personalized tutoring. I can also offer grouped tutoring if anyone is interested. So also they can, if anyone is interested in getting or buying my USMLE high yield points, they can click the links in the description. Thank you for watching, and see you in the next one.